Hi, I'm Marissa Dizatel, and I will be performing the NG insertion, irrigation, and removal. First, I will make sure I have all my supplies near me. I will then enter the room, knock, and introduce myself to the patient, and then I will identify the patient with two identifiers. I will then explain to the patient my procedure and ask if they have any questions. I will then make sure to check my patient's nose, ask him about any past surgeries, polyps, and any other nose surgeries that they might have had. And after that, I will grab my NG tube, put on some gloves first, and I would wash my hands before the procedure. Okay, so I got my gloves on. I'm going to grab my NG tube, and I'm going to want to first measure it. So I'll take the tip, the tip of the nose to the tip of the ear, and down to the xiphoid process. Then I am going to put a piece of tape on the NG tube to mark how far I need to go in. Alright, then I'm going to curl the end of the tube. It'll help so it's better, it'll go in better if you curl it. Then I'm going to put 3 to 4 inches of lube at the tip of my tube. I'm going to grab my anti-reflux valve. This will help from contents coming back up. Alright. And then I am going to tell a patient to take a deep breath, and I'm going to insert it. I'm going to insert it about 3 to 4 inches, and then I'm going to give the patient a little break here. And I'm going to, if I have an assistant or somebody to help me, I will grab a cup of water with a straw and have my assistant. I have a water bottle, but pretend it's a cup with a straw, and I will have my assistant help me with that. So while they're swallowing, I'm going to insert the tube more and say swallow, 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 swallow. The tubes don't really go in all the way on a mannequin, so this is about the farthest I will go. And I'm going to not let go of the tube, grab my piece of tape, make sure it's divided, put it at the nose of the bridge of the nose. This will prevent the tube from coming out when you're doing the checks and stuff. Okay. Now I'm going to take my 60 cc cath syringe, and I'm going to put in 5 to 10 cc's of air and listen to the fundus of the stomach with my stethoscope here. Okay, I'm going to insert 5 to 10 cc's of air while I listen. And I should hear a swish sound. And if I don't hear a swish sound, I can aspirate 5 cc's of stomach content, remove my syringe, clamp it, connect it back up, and I'm going to check the pH with my pH strips. I don't have any, but I would check them with my pH. And it should be 0 to 4, which means that I'm in the stomach, and that is good. So now I'm going to hook up to my suction. And I would also, if I was having troubles inserting the tube, I would grab my pen light and I would check to see if there's any curling, irritation going on. So now I'm going to insert my tube here into the suction. And I'm going to turn on my suction to low intermittent, and I'm going to grab my syringe again and put 5 to 10 cc's of air, and this will prevent the tubing from sticking to the stomach wall. Alright, and then I will remove it. And now I'm just going to tape this to my patient's gown and use a safety pin so it stays. And make sure you give them enough room so it's flexible, so it's not pulling on them. And that is the insertion. Now I'm going to do the irrigation. I'm going to wash my hands, grab a pair of gloves, and I come back to the patient and there's nothing coming back. The patient's stomach looks distended, and so I'm assuming that it is blocked. I'm going to shut off the suction. Then I'm going to take 5 to 10 cc's of air. I'm going to disconnect the suction. And then I'm going to push air in while I am listening to the fundus. Okay, if I pull back and there's no secretions, I'm assuming that there's some blockage going on. So I'm going to pull out my syringe, connect it back up, and I'm going to fill it with 30 cc's of water. Alright, and now I am going to insert my water. And I'm going to pump it until it goes in. Alright, so it's in. Remove my syringe. I'm going to connect it back up to the suction, and I'm going to turn on the suction pump. I'm going to grab a new syringe, fill it with 5 to 10 cc's of air, and I'm just going to listen to this fundus of the stomach, make sure okay, I'm going to insert my 5 to 10 cc's of air. Alright. Now I am going to discontinue. The doctor wants me to take out the NG tube. So I'm going to disconnect it, put a pair of new gloves on, wash my hands, explain to the patient that the doctor wants the NG tube out. Before I start, I'm going to want to Access all the vowel sounds. Make sure, access the vowel sounds in all 4 quadrants, making sure they are active. Then I'm going to want to check the placement of the tube, and now I can take 5 to 10 cc's of air into my syringe and make sure I listen with a stethoscope. Listen and insert my air. Okay, and now I can aspirate the contents for about 5 cc's. Remove it. Connect it. And I will check the pH with my pH strips, so it's good. And now I'm getting towards the end, and I'm going to want to take 20 cc's of water and 20 cc's of air. And I'm going to hold it in an upward position, and this will clean it out. So disconnect, and then I'm going to insert my 20 cc's of water, which will clean out the bile, and 20 cc's of air, which is going to clean out the water. Leave it connected. Tell the patient to take a deep breath, because I gotta remove the tape first, and then I'm going to tell the patient to take a deep breath, and I'm going to remove it, hand over hand motion. Check, make sure everything looks okay. And then I'm going to document, and I'm going to make sure I do good oral cares on the patient. Thank you.